Healthcare is confusing because the rules, the costs, and the coverage change constantly. If you're sitting at the table right now, looking at paperwork and thinking, I need to figure this Medicare thing out, that's not a failure. That's awareness. And awareness matters more in 2026 than it ever has before. This year alone, several Medicare costs changed in ways many people didn't expect. The standard Medicare Part B premium increased again in 2026, now over $200 per month. The annual deductible went up as well. These numbers are set each year by the Centers for Medicare and Medicaid Services based on projected healthcare spending, and they directly affect monthly budgets for anyone on Medicare. Prescription drug coverage changed too. The annual out-of-pocket cap under Part D increased for 2026, meaning some people will pay more before their drug coverage fully protects them. These changes don't always feel dramatic on paper, but over the course of a year, they add up. There are also new rules quietly rolling out. In some states, certain outpatient services under Original Medicare now require prior authorization as part of a federal pilot program. That's a shift many people don't hear about until a service is delayed or questioned. At the same time, new drug price negotiations are beginning to take effect, lowering the cost of some medications, but only for specific drugs, and only if you know what applies to you. This is the reality most people don't hear clearly enough. Medicare is not static, and relying on last year's understanding can put you at risk this year. That's why Medicare decisions are not about finding the best plan. They're about understanding which path fits your situation right now and knowing when that situation changes. Timing matters, income matters, health needs matter, and assumptions get expensive. We don't give advice. We don't recommend plans. What we provide is structured clarity. The MCP Decision Tool helps you understand how Medicare paths work, what decision points actually matter, and how changes like premium increases or new rules interact with your circumstances, without pressure and without guessing. You can start there today. That tool is linked below. But here's the part most people don't think about until they've already been affected. Medicare doesn't just change once. It changes every year. Premiums rise, deductibles shift, drug rules evolve, authorization requirements expand. Deadlines move quietly. And the real risk isn't making one wrong decision. It's not knowing when the rules change again. That's why we created the Medicare Clear Path membership, as a protection for you. Members are the first to know when Medicare costs change, when coverage rules shift, when new requirements roll out, and when something important happens that could affect their care or their wallet. Most people find out after the fact, when a bill shows up, or when coverage doesn't work the way they expected. We make sure you're aware. Think of it as an early warning system. Protection against outdated information. Protection against surprises. Protection against making decisions based on last year's rules in a new year. If you rely on Medicare, staying informed is no longer optional. It's part of protecting yourself. So start with clarity. Use the MCP Decision Tool linked below. And if you want to stay ahead of changes instead of reacting to them, the membership is there to make sure you're never guessing, never behind, and never caught off guard. Clarity first. Decisions second.